Hi everyone. My name is Naomi. Thanks for the intro, Chris. I'm going to be sharing my the work I did both in at the end of my undergraduate throughout the summer between masters, as Chris mentioned. I'm originally from Winnipeg, Manitoba, and I am currently in Thunder Bay at Lakehead University. Before I begin, I wanted to share, are you guys seeing the right slides, first of all? Yes. Okay. Before I begin, I wanted to share a bit about my perspective, where I'm coming from. So in the middle here is my gorgeous family. My brothers are in the middle beside me. They're both super tall. I'm quite tall too, so that just shows how tall my family is. Um, on the right is my mom, and on the left is my dad. I'll tell you a little bit more about my dad, as his story is relevant to my work. So, my father was adopted as an infant and 9 years ago reconnected with his biological family, where he learned about his roots, the culture of the Red River Métis, and from that derived a strong sense of belonging through the process of reconnection to culture and family. And then witnessing that oriented me to the importance of culture and belonging as I pursued my career in psychology. Attached is a newspaper clipping from or about a sixth generation ancestor, Louis Gonzalez Zastri, in which he speaks of the buffalo hunts fighting alongside Louis Riel at Fort Garry to prevent Manitoba from becoming mere adjuncts or colonies of Canada. I thought that was pretty cool. I started working with Access Open Minds Indigenous Youth Mental Health and Wellness Network around 2 years ago. On the right are some photos of me and my colleagues, Cliff, Gage, and Elder Hazel, presenting in West Kelowna with the support of Carolyn. Before I started working at Access, I worked at Stony Mountain Institution as a summer student in the role of Indigenous Liaison Officer, where I worked closely with Indigenous initiatives and elders there. And after that work, I began reflecting a lot on what I'd learned. One of my roles was to interview Indigenous men on their Indigenous social history factors. It was a report that would be used for institutional processes, and it made a summary of essentially some adverse experiences that they had throughout their lives, as well as the offense that led them to Stony. What I noticed from these interviews was the focus was often biased towards deficits or adverse experiences and not always relevant to the men I was speaking to, and included heavy focuses on things like substance abuse and child's family services involvement, while not quite focusing on other important aspects of their lives. I also noticed programming was often based on the assumption that men are abusers rather than victims of abuse, leading services to only address a fraction of the challenges they may be facing. I also noticed a number of the men who told me, or there was a number of men who also told me they had never participated in ceremony, met with an elder, spoke to someone about their experiences, or even knew that they were Indigenous. So many men were accessing ceremony, elder support, professional support for the first time only after entering prison. I also noticed many moments of joy hanging out and chatting outside the sweat lodge, the bond some developed with elders, quiet moments laying in the grass after medicine picking, eruptions of laughter from the drum group when they realized how offbeat they were, the sense of purpose and commitment that lodge workers had when tending to the fire, making stew and bannock every day. This experience left me with questions about the men and boys outside of this context and what supports were available for them. I also wondered how what the assumptions we make about men and Indigenous boys, how that influences the services that they have access to. So, while the research on Indigenous mental health has expanded in recent years, much of it focuses on the population broadly or on specific groups such as women, children, and youth. Indigenous boys and men remain underrepresented in both research and programming despite facing disproportionate mental health challenges. Research done within the network has identified gaps in providing care for Indigenous boys and men, including an environmental scan of mental health services, which identified only one program for boys and men, which focused on increasing resilience and suicide prevention. Carolyn Melrose did an environmental scan of healthy relationships programming, and that environmental scan really set the stage for the scoping review, which I'll share with you guys. They identified that within healthy relationship programs, there was a heavy focus on interpersonal violence within the programs that were available, which were limited. And they also identified among the men who they'd spoken with, there was a strong interest in boys and men's programming. So that led to the scoping review that I conducted along with Chris, Vidya, and Carolyn. The objective of this scoping review is to map existing literature on mental health supports available for Indigenous boys and men in Canada. We wanted to identify the range of services, examine the impacts and outcomes, and identify key themes. We followed a PRISMA methodology, considered literature discussing programs for men between the ages of 9 to 30, published before the year 2000. We looked at both gray literature and peer-reviewed literature and used 5 different databases as well as targeted Google searches to identify literature. Among the 45 publications, 26 unique programs were identified. So here's the little graphic to demonstrate the geographic distribution. The highest concentration of programming was in British Columbia with 10 separate programs identified. And then there were no programs identified in New Brunswick, Nova Scotia, PEI, Newfoundland and Labrador, Yukon, or Nunavut. In terms of age distribution, the largest number of programs were for those age 18 or over, where there were the fewest programs dedicated to those between the ages 9 to 12. It's important to note that within the purple section, only one program focused on specifically the ages between 20 to 30, and that was focused on distance from gang-related crimes. This is of note when we consider that this group can be particularly vulnerable to service gaps as they age out of youth programming. There was a variety of outlined program objectives across the literature, and many programs had multiple targets aside from their primary objective, taking a holistic approach to wellness. However, over a third of the programs focused on violence prevention and recidivism, followed then by themes or focuses of empowerment, self-esteem, social well-being, cultural engagement, health behaviors, and then material support such as housing support. Indigenous communities were involved in the development of all but one program. Many programs involved elders and knowledge keepers, as well as community partnerships, and a few involved youth as peer facilitators or consultants. The outcomes were reported for 21 of the programs. The most common indicator of success with was a strengthened connection to culture, tradition, and values, followed closely by reducing harmful behaviors such as smoking, violence, and recidivism, and then strengthened relationship with peers, community, and self, and lastly, improved health behaviors, help seeking, and health outcomes. Following the content analysis that we conducted, we found the most common theme was integration of ceremony and traditional knowledge, followed by peer connection and brotherhood, and then skill building. Integration of ceremony and traditional knowledge was shown to promote positive relationships with self, family, elders, and community, was critical for building trust, promoting traditional values and knowledge. We know from the literature that the engagement with culture promotes the 4 domains of the mental wellness continuum framework: hope, belonging, meaning, and purpose. This was followed by brotherhood, which led to feeling safe in program, feeling like they belonged, a willingness to share experiences, and also role modeling and leadership relationships. This includes intergenerational relationships, as their importance, we know their importance, as it was highlighted by Elder Tecumseh's story at the beginning of the meeting. And then skill acquisition covers a variety of domains, including health and mental health related skills, interpersonal skills, practical skills, and creative skills. Results suggest that framing mental health and wellness supports as skill development was particularly useful for engaging boys and men in programming. So some of the themes, aside from the themes that arose from the content analysis that we noticed was there's a large number of deficit-focused programs. So our review found that 35% of the programs centered around addressing violence or recidivism, and 23% were designated for individuals who had been previously incarcerated or involved with the justice system. It's consistently shown in the literature, as well as within my own observations, that experiences of culture, interactions with elders, and mental health supports often happen for the first time only after entering correctional institutions. This finding shows that few programs focus on the strengths of Indigenous boys and men from the outset. In other words, a large proportion of programs are designed with a downstream approach built to address history rather than an upstream approach, which helps Indigenous boys recognize and build on their strengths from early on, which leads to the theme of youth and young adult engagement. So programs for young boys were relatively uncommon, especially programs for age 9 to 12, as I mentioned. The importance of creating dedicated spaces for youth and young men is underscored by evidence that programs open to all men or all boys broadly often had fewer younger participants. Carolyn's work in consultation with the advisory council suggests that the lack of male-specific programming is likely due to fear of low turnout, while noting that yet there is a clear desire for more boy-focused initiatives expressed by boys and men. In response to the lack of engagement of young men in programming, it's important to involve boys in the design process to create programming by and for young Indigenous boys and men. Insofar, a small number of initiatives have integrated young men's feedback, engaged youth as facilitators or mentors, or proposed roles for youth in governance in the future. But currently, no programs identified in this review involved young men directly in program development and governance from the outset. Further, there was a theme of spaces, specifically social spaces and physical spaces. So social spaces include safe, confidential places that promote trust and a sense of belonging. This was especially important as when men were discussing taboo topics. This also includes discussion around men-only spaces. So the literature was a bit split on the inclusion of women in facilitation. It was shown that men-only spaces promote a sense of understanding between participants and facilitators and aligns with expressed desire from participants to have male facilitators. There's also a need for male role models and mentors in healthcare broadly. And so building capacity in those areas should be prioritized. Then physical spaces are equally as important, specifically designated room to gather, play, socialize, participate in ceremony. One of the frequent limitations identified in the literature was a lack of physical space. That leads me to, the identified barriers within the literature. So first, most commonly was the lack of financial and human resources. Staff often identified that they were working off the sides of their desks to keep these programs running. As I mentioned, limited physical space, which ties into lack of financial resources. Then there's also the limitation of low youth turnout or fear of low turnout, preference for male facilitators, which is often limited. There's also, in some programs, a lack of cultural relevance for all participants, especially in the correctional setting, in which you have a ton of guys from all over the place. And that leads me to another identified barrier. Within correctional settings, there's often a struggle to have a sense of safety, as well as this pressure or lack of autonomy when participating in programs because they fear being gated or punished for not following through on correctional plans. So correctional settings have some pretty severe limitations in terms of autonomously participating. So implications for the findings of this research: we need to involve boys and men in the development of our research and programming from the outset. Specifically, there's a need for young boys age 9 to 12 and young men age 20 to 30 to be represented, as well as all boys and men, just considering the lack of research and evidence available. Programs should be tailored for local contexts, especially within those underrepresented provinces and territories I identified. Strengths-based models and proactive programming should be a priority. We need longitudinal evaluation of programs and ways to address the lack of resources through funding and policy efforts. So in terms of next steps, what's next for this research? What are we doing with this knowledge? Our team has successfully received the Indigenous Gender and Wellness Grant. So we'll be working with 2 peer community co-researchers to develop a knowledge bundle focused on healthy relationships informed by the realities and experiences of community, including that of Indigenous boys and men. And we're currently conducting a review as an extension of the environmental scan, which Carolyn conducted that I mentioned previously. Through conversations with other students at conferences and conversations with community members, it's clear that there are many programs which this review didn't identify simply because they weren't published in peer-reviewed literature or on the internet or in writing. So therefore, in order to identify a more broad range of programs that may be available as we come into contact with them, and as Gina mentioned earlier, we're working on developing a living, growing repository of programs known within our network so that community members can find relevant programs within their area. We're developing a commentary on best practices for research with Indigenous boys and men. My master's thesis will explore specific expressions of transdiagnostic distress within Indigenous and non-Indigenous boys and men. And lastly, we're currently developing a Healthy Youth Teams grant in which we plan to gather knowledge on how Indigenous boys and men define wellness, what it means to be a healthy man, and then co-creating programming and supporting mentorship pathways with individual communities, and then implementing and evaluating programming designed by and for boys and men. If you are interested in getting involved in this work in any way, we do have a link just as an expression of interest, which you can fill out. Also, if you know any young men who are interested in research and think this would be a great place for them to get started, please contact us. You can contact Christy Kowach. She's the PI on this grant. And yeah, that would be great. And then I just wanted to plug this. The timing of this presentation is quite topical. June 6th is Blue Jean Jacket Day. So I got my blue jean jacket on. So this day was created to raise awareness about missing and murdered and exploited Indigenous boys and men in Canada, as well as to draw attention to the gap in funding and opportunities for Indigenous boys and men. So on June 6th, I'd encourage you and your teammates to reflect on how we can continue to support and uplift our boys, as well as every day. And that's all for me. I'm excited to hear your thoughts, how you guys have been engaging with Indigenous boys and men, some initiatives that you guys have taken on, anything. Those are my acknowledgements. Thanks, Chris, Vidya, team, Carolyn, Gina, Jocelyn. Yeah, the team was really supportive and instrumental in like guiding this whole process. So I appreciate you guys.
Thanks, Naomi.